Hello everyone, this is the second MCQ of day 2. So in stem of the MCQ, in history part, a neonate is born by spontaneous vaginal delivery with uneventful antenatal and perinatal period. Birth weight is 2.6 kg, so it is normal birth weight. He has a vigorous cry at the time of birth, able to close both the eyes. On crying, the left corner of mouth moves left and downward, which you can see in this image. Left corner of mouth is deviated toward the left side and downward, while the right corner does not move. So right corner is not moving. The face is symmetrical when neonate is quiet and sleeping, while when the newborn is crying, face is asymmetrical. What is the clinical diagnosis of this newborn? So options are left-sided congenital hypoplasia of depressor angularis oris muscle. In B option, right-sided congenital hypoplasia of depressor angularis oris muscle. Or the C option, left-sided congenital facial palsy, and D option, right-sided congenital facial palsy. So let's discuss all the points. So either patient is having the right-sided or left-sided either facial palsy or hypoplasia of depressor angularis oris muscle. So first, pathology is present either on left or right. First, differentiate this. So here you can see newborn is able to move the left side of the corner of mouth while not able to move the right side. That means pathology is present on right side. So either B option or D option, right sided, not the left sided, because left side of corner of mouth is moving. That means normal muscle, normal facial nerve on the right side. Now differentiate these two conditions, either facial palsy or depressor angularis oris. We know in facial palsy, newborn will have the affected nasolabial fold. Also, newborn will not be able to close the eyes, and if lower motor neuron, then furrowing will also be affected. So in this newborn is able to close the eyes, normal nasolabial folds are there, only affected is mouth. That means facial palsy is ruled out. So the right option for this MCQ is right-sided congenital hypoplasia of depressor angularis oris muscle. So answer is B. Similarly, in this MCQ, they can ask what would be the treatment for this condition. Other stem will remain same, but what would be the treatment? So options are either no treatment is required, or cosmetic surgery in infancy is required, or botulinum toxin injection should be given in the affected muscle, or physiotherapy. So we know this condition does not require any treatment. If during adolescent or adulthood, if patient is having visible asymmetry, then only cosmetic surgery is required, not in infancy. No role of botulinum toxin in this condition, no role of physiotherapy. So the right answer is A. We have to reassure the parents and we have to wait and watch. Now the learning points is congenital hypoplasia causes the facial asymmetry of depressor angularis oris muscle. In this condition, newborn will have the symmetrical forehead wrinkling, eye closure, and nasolabial fold depth all will be possible on the affected side. If this part is also affected, that means newborn is having facial palsy. So in the depressor angularis oris muscle hypoplasia or agenesis, only the angle of mouth will be affected. In isolated congenital hypoplasia of depressor angularis oris muscle, no treatment is required because asymmetry is not noticeable in a grown-up child. So what are the differential diagnosis? Whenever newborn is having facial asymmetry at the time of birth, either congenital or traumatic facial nerve palsy, or congenital hypoplasia, aplasia of depressor angularis oris muscle or depressor labii inferioris muscle, or the nerve supply to these two muscles by the mandibular branch of facial nerve. Its compression can lead to the facial asymmetry in newborn. So we can differentiate all these conditions. In facial palsy, we know the eye closure, nasolabial fold, furrowing, all will be affected. Again, we have to differentiate either lower motor neuron or upper motor neuron. While in the hypoplasia of depressor angularis and labii, patient will have the normal nerve conduction studies, while this will be affected in the mandibular branch of facial nerve. So we can differentiate clinically and we have to go for further investigation. For further learning, you can see the video of congenital hypoplasia of depressor angularis oris muscle on this YouTube channel. I will share the link in description box. So this is about this MCQ. Thank you so much.